Hey, this is Vance Smith, and I did my research on pragmatic language therapy. The first thing we need to discuss is what pragmatic language impairment is. In some of the older research, it was known as semantic pragmatic disorder, but it is the same thing. Pragmatic language impairment basically affects the social use of language in a variety of ways. The research has agreed that children with pragmatic language impairment often have deficits in the following areas: social inferencing, appropriate response to nonverbal cues, that would be like reading body language and gestures, topic initiation, maintenance and termination, turn taking, eye contact, the use of prosody, and narrative skills. Why does it matter to us? Why should we be concerned as speech language pathologists about pragmatic language impairment? Well, it's actually a significant and growing portion of our caseloads. As you all know, there's a huge increase in autism diagnosis, and children with autism often have pragmatic language impairments. Also, children with ADD and ADHD can have PLI as well. Furthermore, many children go undiagnosed. They're good at the more formal areas of language, and it fails to show up on standardized tests that they have issues with pragmatic language. Also, if this is left untreated, children fail to develop age-appropriate pragmatic skills, and that leads to a variety of long-term problems. As they get older, they can have mental and emotional health issues, behavioral issues, problems in school, problems building relationships and forming friendships, and all sorts of things. What the research says. There are many challenges when conducting pragmatic language therapy, as I found out. It's really difficult to systematically review because there has not been a study large enough that looks at each individual aspect of pragmatics. Many therapies focus on multiple areas of pragmatic language at once. So it's difficult to say, this therapy was specifically great for eye contact. Also, the participants often have concomitant issues, and that can affect validity and reliability. Like I said earlier, it's hard to target one area of pragmatics, and problems measuring carryover. It can be really difficult to see how they do it in real life, how they carry over what they've learned in the therapy room to outside. So more research needs to be done, and that's our responsibility. So we as clinicians should use what we observe and what we've learned in our own clinical practice and write about it. However, the research does seem to agree on the following. Early intervention is key. Involving parents is crucial. Naturalistic approaches work very well for children, and there are steps for effective therapy that we'll get into later. Early intervention. Diagnosing pragmatic language impairments early and beginning treatment early leads to better results. That's with any therapy. So it's our job as SLPs to be good diagnosticians and find these kids and get them into therapy as soon as possible. Because like we talked about earlier, if we don't and they go undiagnosed, it can turn into a whole host of problems later down the road. Early intervention involves therapy based on the way children naturally learn pragmatic skills, which is through interaction with their parents and caregivers. So we want to sort of model our language therapy for young kids in a way that they actually learn pragmatic skills, which is through interactions with their parents and caregivers. Parental involvement. This allows the child to interact with the parent in a natural way while still targeting the social skills. Parents are invested in the therapy and feel like they're part of the team, and we want to do this from the very beginning. We want to involve them in goal setting. We want to involve them in the approaches. We need to be able, as SLPs, to teach the parents how to do therapy on their own, and this provides more opportunities for the child to carry over what they've learned in the clinic in a variety of settings. The research focused a lot on play-based therapy. Play-based therapy provides predictable interactions between the child and the clinician or the parents, and allows the child to observe clear models of the communicative process and to experience consistent, naturally reinforcing consequences. It can be done in multiple environments and is fun, kid-friendly, and natural. In my paper, I talked about several things you could do involving play therapy. You can use themes that mimic real-life situations, like going to the grocery store and how you would act there, what social skills you would need for that, striking up a conversation with a friend, things like that. Play-based therapy targets multiple skills at once. It can target turn-taking, eye contact, adapting to communication breakdowns, and that's a big one for parents. Social inferencing, topic initiation and maintenance, response to verbal cues, etc. Pivotal response training, or PRT, is one therapy that's often used for targeting pragmatic language impairments, and it's based on the principles of ABA, which is Applied Behavioral Analysis, and it teaches pragmatic skills through operant training. So we want the child to have appropriate responses to known situations and then increase the rate of those appropriate responses with a positive affect. PRT can be used in a play-based context like we talked about earlier, and it's easy for parents to learn and implement, which is important because we want the parents to be involved and we want the kids to have multiple opportunities to practice their skills. Pre-linguistic MILU teaching is similar to ABA and PRT. It uses natural prompts and responses and encourages the child to make requests through nonverbal means. And so this can be used before the child is talking, or for children that are nonverbal. It can be used in very early stages of intervention, and like pivotal response training, it's easy for parents to learn and perform on their own. Steps for successful intervention. Through all the research that I read, I kind of got a feeling that these were the steps that they wanted you to follow when implementing therapy for pragmatic language impairments. First of all, you need to do a pre-assessment and establish goals. Then you need to teach or give information about the skill you want the child to master. Then the child needs an opportunity to rehearse and practice. You give feedback, and then they generalize. Now, this can be applied to all sorts of therapies, but it's especially effective with pragmatic therapy. Pre-assessment and goals. Like we talked about earlier, we want the parents to be involved. So goal setting and pre-assessment should always be done in conjunction with parents, and if you can get teachers on board, that's great too. During the pre-assessment process, you are looking for the child's strengths and weaknesses in a variety of settings. So you want to see what they're doing in their home, you want to see what they're doing in the classroom, you want to see what they're doing out at recess. And so the more you involve teachers and parents, the more you get a broader idea of what the child is able to do and what they're not able to do. And that'll help you establish your zone of proximal development and help you know where to begin therapy. It also incorporates the priorities of the parents and teachers into therapy goals. We want to know what's most important for the parents. They're the ones who are living with the kid. What do they want their child to be able to do? What's most important to them? And when we do this, we involve them in the therapy process and they feel invested. SLPs should observe the child naturally interacting in multiple environments, like we said, and you can do this in a variety of ways. You can videotape, take a language sample. There are all sorts of checklists out there that you can use to assess their pragmatic language skills. Information and teaching. Very simple. You present the child with a specific communication skill that they're targeting. So if you're working on turn taking, you can model appropriate turn taking. You can use verbal instruction. You can use books. You can use play-based themes. You can use group therapy, role play. There's so many of these that you can do, and you can really be creative. books are a great way to engage younger children. You can look at examples of appropriate turn taking, for example, in the book and have the child identify that and then try to mimic it. So you can teach through books, you can teach through play-based themes like we talked about earlier, going to the grocery store. Group therapy is also very effective, and role play. Rehearsal and practice. Providing the child with an opportunity to practice or rehearse their specific pragmatic skill. And again, it can be done in a number of creative ways. Books, play-based themes, group therapy, and role play. When you get to this point, a lot of the research out there talked about using checklists before and after role play. So for example, you would have a child demonstrate an appropriate pragmatic skill through role play, but before they began, you would give them a checklist of options for appropriate responses so they know what they're doing. And then afterwards, it can be used as a way to evaluate how they did in that particular situation. Feedback. The clinician should offer feedback and reinforcement based on the child's use of the pragmatic skill targeted. Some of the research talked about it being tricky with pragmatic therapy because you can provide too much or too little, and you have to know when the right time to interject is. Sometimes you need to be mindful of letting the situation sort of play out before you interject. Also, we talked about using the checklists as a way to evaluate, self-evaluate for the child afterwards. That can be a form of feedback as well. Modeling, videotape assessment, verbal feedback reinforcers, all of those are effective in letting the child know what they're doing right and what they're doing wrong. Generalization. Once the child has mastered the skill in a controlled setting, the SLP should shift the focus of intervention to generalizing and maintaining the skill across all environments. All the research says this. They haven't mastered the skill until they can do it in a variety of settings. And this is where you also need to collaborate with teachers and parents so that you can see what they're doing outside of the clinic. You also need to introduce sabotage and provide less than ideal situations to see how the child reacts in those situations. I think this is very important for establishing the fact that they have mastered the skill. You also need to collect data and monitor progress and track growth during this process. Conclusions. The research is lacking in the area of pragmatic language therapy. It's difficult to do, and it requires a way to systematically review it that can be very difficult. So it's up to us to really try to add to that field through our clinical practice. The research also says that naturalistic approaches are beneficial, especially for children. Don't forget the steps when you're implementing these therapies, and involve the parents on all levels of therapy. That's it. Thanks.